Well, good afternoon, everyone. So this morning, when I was with the Commerce Minister, I asked him if he thought India could save the NHS. And there was a gasp in the audience. And half of you thought, oh no, that's so political. And the other half thought, yes, that's a very good idea. So as I explained, I was joking that many of my great colleagues in India have great ideas about the National Health Service. And I have a great and very diverse panel that might talk about that. So if I do them from the far end. So Lord Darzi, I feel a bit weird in introducing Ara, because if you don't know who Ara is, you know nothing about medicine, okay? Ara is a real rock star in the world of medicine, very distinguished surgeon, but also innovator in medicine, head of the Fleming Institute that he might explain something about as we're talking, but also has been a government minister and also wrote a pretty unsparing report recently on the National Health Service. So no one knows more about both medicine, innovation, and the health service. Now, Monica Huang is country head of Zydus Lifesciences. We haven't met before, but very keen to hear an entirely different perspective on health in terms of India and the global picture. And then Alisha Moopen is Managing Director and Group CEO at Aster DM Healthcare. You've just flown in from Dubai, right, which also illustrates you have a global view. So I suppose let me start. I might start with you, Ara, because the timing of this conversation happens to be particularly apposite for two reasons. Our government has just announced a huge increase in NHS funding. It's also done some quite radical things, like abolish NHS England. But also, I've heard you give two different entirely views of the future of healthcare in the UK. You've given an unsparing analysis of the failings and weaknesses in the system, but also I've been at events where you've spoken with the most ardent and inspiring passion about data and precision medicine and a whole range of new frontiers. I wonder, what do you think are the key challenges the NHS faced where innovators in India might make a contribution?
Thank you, Syrian, and lovely to see you all. Let me start by saying a few words about how transformative has been looking at India's health system as a whole over the decades. I mean, it's an unbelievable achievement, and congratulate all of you in this room on your ability to reimagine the future. Ian mentioned the report that I did last September. I must say I wasn't waiting for a phone call to do a report of that nature, but I was convinced that the NHS's performance needed a baseline. A baseline, you know, if you know the facts, then at least you can plan for a better future. And that was a piece of work that we had to do in 8 weeks. And I can't remember doing anything in the National Health Service within 8 weeks. And that was facilitated, as Sir Ian mentioned, for the first time, and I've worked in the National Health Service for more than 30 years, I'm also an academic, I managed to get access to data on 61 million people for 24 years. And that was an amazing thing to have in your hands. And numbers don't lie. And at the end of the day, once we did the analytics, we published 335 slides for a period of time, and what, Ian, you're referring to is the raw facts of where the National Health Service was. And I was shocked, and I've used that word in my report on numerous occasions. But, you know, as I described it at the end, that the NHS is in a critical condition, but the vital signs are still stable, but not for long. So it needs significant reform, it needs significant transformation, and that's the process we're going through at the moment, which is the 10-year plan. And we have a lot to learn from our colleagues here in India. You've done some really transformative changes in India, which potentially will be extremely useful if we embrace some of these innovations and the way you transformed your system back in the United Kingdom. So this partnership and the timing of this conference couldn't be better.
And let me ask you about particular things that really struck me in India that may be relevant to things that you care about. I mean, one of the things that's very striking when I go to India is how many private companies in India are doing amazing research on the future of diabetes, cancer, antimicrobial resistance. I mean, Indians and British people are both humans. We have the same dilemmas. And, there are downsides also to India's rising prosperity in terms of disease profiles. I wonder how you see India and the UK cooperating on some of that pioneering research.
Yes, I mean, listen, India's contribution was very significant during COVID. We all know the Serum Institute and the production of the COVID vaccine. And certainly you came to our help at a very critical moment because we hadn't really done the proper procurement that we were planning to do. So that in itself showed your power, your intellectual power, your production side when it came to that. But I mean, historically, I've had many, many colleagues, and I'm sorry to go back and mention the two that I've historically knew, Narinyaha Hospital, I mean, some of the Aravind, for example, the eye centers. These were in my report back in 2008 when I published High Quality Care for All. Doing case cataract surgery. I think 99.9% of all cataracts in the whole of India is done in an outpatient department. There is no such person going to a hospital to have cataract surgery. We still have a significant of our bulk of our cataract surgery is done in a hospital setting. Yeah. So it's not just the big disruptive innovations like vaccines. What you've mastered is process innovation and creating value, not just economic value, but also health value, and finally, and more importantly, value to the poor patient who has to go through the most convoluted pathway to achieve an endpoint and get discharged. And that's the simplicity of the system, which combines both quality, safety, and more importantly, cost effectiveness. Let me come back to the point of cost. We're spending 10% of our GDP on health. This is the highest percentage expenditure we've had since the creation of the National Health Service back in 1948. And it's not sustainable. We can't be the basket case the United States is in, which is 20% of our GDP. It's just we cannot afford it. And on top of all of this, may I just say, is the life sciences side. I talked about serum, but just look, my good friend Yusuf Hamid is here. Look at Cipla, the innovations coming from there. Absolutely transformative. And we need to think through, how do we embrace these innovations in a system like ours? And we need true partnerships between different organizations. There is an opportunity of co-learning in a number of different areas. And I always say it, we could learn from the cradle to the grave, whichever pathway you can think of.
Excellent. Monica, let me, your company is heavily engaged in generic drugs and therapeutics and a whole range of medical innovations. I want to ask you about something that really struck me when I was talking to the Commerce Minister this morning. It happens to me all the time when I go and speak to innovators in any sector in India. They are hypersensitive about price point in a way that doesn't really happen in European markets. And they say to me, look, you have to understand, when you're 1.4 billion people, a tiny difference in price makes a difference between 50 million and 500 million people having access. And it seems to me in a way, the Indian tradition of Jagad and frugal innovation is a very interesting cultural aspect of Indian companies. Tell me a bit about what your company does, but also how you think what you do might be relevant to the UK health market.
Great. I was listening to Lord Daz, and what you said is like music to my ear. It's very well articulated. You were amazed with the journey that the Indian healthcare has gone through over the past few years. That is exactly the very, very nice case that can be presented. We started as a generic company doing just off-patent manufacturing of generic medicines. No difference from any company like Sun Pharma or Dr. Reddy or Cipla, as you mentioned. And then we see then those commodity product is not taking you anywhere. The innovation is the future. So we get into an area of innovation. Now we have, from vaccine side, we have the first NDA vaccine that we launched during COVID combat the pandemic, where we're really focusing on delivering hundreds, millions vials to the people who are in need, and not necessarily the high-income countries. That's what we committed to do. And in terms of medicine innovation, we are spending a lot of money to come up with new chemical entities. So we are the innovator, not just a generic medicine manufacturer. So for us, it is also giving us that level of competitive edge. And the focus is really to look at what we can give to patients to help them increase the access to cutting-edge innovations. As a global company, we are operating in many continents, and we finally decided we would like to come to the UK because we love this market. It's fascinating. As a country, we really encourage innovation. We encourage competition as well, so it is a tough generic market to be in, but we also very much encourage innovation for patient benefit. So Zydus is launched a number of new innovative molecules within the UK. In the same time, we are also bringing a lot of medicines to help deliver the cost saving for NHS. So I see the link here as a generic manufacturer transitioning into innovation focused organization. We would like to have our product, that our innovation, our development come to the UK through whatever pathway we can to help NHS for cost savings.
And how are you finding here? The reason I ask is, let me tell you something really surprising. When we do surveys of visitors to the Science Museum, who are, after all, the most intelligent people in the world, of course, and very interested in science, I tell you what's very surprising is that the one sector they're quite suspicious about is pharma. And so it depends what you think. So you're talking about the patients and cost saving. If you were to ask most of my visitors, they would regard pharma companies as evil capitalists who are aiming to make enormous profits. Do you come across that? I mean,
I do, actually.
You see? Oh, good.
But
so how
however,
do you fight back, Monica?
Well, I think there's a misconception of innovator and a generic company. I should give you some interesting facts. In fact, this morning at the round table discussion, we also talked about that. I'm here representing generic companies, pharma companies. In fact, in the UK, 4 in 5 medicines is supplied to our patient you get in your cupboard for your family is actually generic.
Yeah.
And 1/3 of the product is made in India nowadays. And jointly, generic and biosimilars, they are saving over 18 billion pounds for NHS each year. This is the latest stats we have. Now, it's not enough, actually. I believe, or based on the research we had, we could save more for NHS if there was efficiency within the system, if there's a harmonization of the regulatory framework, that we can come in quicker, deliver the launch faster, and for less. We can supply the medicines for less. So we are not the one that should be labeled as a catalyst. We do get that bias a lot, but I think it's important in this forum to share those stats and knowledge that it's not quite publicly available to everyone.
Excellent. And Alisha, I mean, you've just, as I said, just flown in from Dubai. You have an amazing network in terms of private medicine. What's your view of the way that your company might contribute to the healthcare system in the UK?
Thanks, Sarian. So we have a network, a fairly large network in India. We've got more than 40 hospitals, 60,000 people, doing tertiary, quaternary care work. And we also operate out of Middle East in a highly insured market, UAE, GCC countries, right? So when you look at the NHS, like what everyone discussed, of course, we're sitting in a little bit of a pickle right now. And it's so many things going on. It's like a perfect storm. You've got backlog from COVID, you've got the Brexit issues, and then you've got all the incredible transformations that's happening in healthcare. Where do you focus on? So at least from a healthcare, from a private healthcare perspective, our view is that how do we sort of kind of create collaborations so that you're at least able to kind of look at the backlog? If there is a way to kind of say that I can take care of the past and sort of clear the past, so I can actually focus on the present and the future, I think that's where you really enable very powerful partnerships, right? So, and that's what like things like IGF is all about. How do you make it purposeful? How do you make it humane? It is absolutely inhuman if somebody needs to wait 4 years to get their surgeries done, if they wait like 1.5 years to get an MRI. We have such a strong partnership between these countries, whether it is rather than making it individual to individual, whether it's government to government, I don't know, maybe it is to political, like you said earlier, Sir Ian. But even from institution to institution, I don't know, between the colleges, between the big sort of corporate hospital groups, you know, where you've got JCI accredited, NABH accredited, good hospitals that you can rely on. I heard a staggering statistics yesterday where they said that NHS pays almost $3 billion per year on locum. And it's crazy, right? Like if you're able to say that, hey, I'll send 500,000 people, get this done so that it doesn't escalate into a bigger health issue for someone. But you need to think outside the box. We can say this can take 4 years, I'll fix it. But why not think outside and see if there are other partnerships that can fast track this thing for us? And that's what I think India does beautifully. You can do things on scale because you have to. There's 1.6 billion people. If we have to serve, you've got 250 million people on the public scheme with the Ayushman Bharat. But then you also have a very active private sector that makes sure that there's affordability, there's a different system that's running as well. So I think those kind of partnerships are what we need to do. Yesterday we met the BAPIO group, the British Association of Physicians of Indian Origin, 100,000 doctors here. How do we create these bridges, whether it's Indian origin or not, like with the colleges here, you know, you've got great institutions, deep mind, great minds. So I think that's where we can really kind of put things together to not talk about solving a problem 4 years later, but solving it this year.
You know, I have a joke with my colleagues whenever I'm in India. You know, I have a habit, which is I read the Times of India over breakfast. And when I've ploughed through the pages on Bollywood stars, what I then plough through is the endless adverts for new hospitals and facilities in India. And tell me, I mean, one of the things that other colleagues say about your group and others is that you just how patient-centric you are.
Yeah.
And tell me a bit about that. And the reason I ask is if you go into our medical galleries, we have a great display on the foundation of the NHS. And it's a noble thing, but it's a great monolith. And it's a beautiful thing, but actually the patients are just part of the narrative.
Yeah.
Tell me, do you think you have a particular insight into being really patient-focused?
No, absolutely. I think our biggest two stakeholders are always the physicians and then the patients. And I think what's also great now is with things like media, social media, netizens, you've got a check and balance system. If people are upset, they're angry, they're online, they're talking about you, we as a group, we're obsessed, we're customer obsessed, patient obsessed, we're looking at every interaction. How many Google ratings are coming in? How are they rating our 40 hospitals? What is my NPS score? We're deeply listening, right? So that we can improve. And that agility and that rapidness is so important in healthcare. Again, on the other side, very important to listen to your physicians. Just what Monica was talking about, the generic drugs. Okay, I have 5,000 doctors, 500 want something, another 500 want something else. But if I'm actually able to say, hey, why should you be doing the generic drugs for people who are coming from this strata? You can do maybe the branded, the innovator molecules for those who are paying the high-end insurance. How do you create a sustainable model? So I think it's very important we listen both to the physicians, show them the data, what is the accessibility you're creating with options for different people, and then being customer obsessed, patient obsessed is absolutely necessary.
Well, I've already learned the next time I'm ill, I need to phone you. That's the great thing about doing my job and has great connections. Can I come to a final question to you, Ara? You have all your vast scientific experience, but also you understand politics very well. And let me just explore a little bit of a conversation that we touched on with the Commerce Minister this morning, which is trying to change the narrative. So rather than the cooperation between India and the UK on medicine being purely commercial, the idea of much more co-development of solutions. I mean, I tell you what's odd. When I talk to a lot of politicians, they say, I don't really understand why we have this hang-up about alliances in the commercial sector, because all our patients care about is being well. They don't care who provides the surgery. In your experience as a politician, what's the way of getting people to be a bit more open-minded?
Well, we tried this back in 2008, where you say NHS is a system. Quality should be the organizing principle of a system. And you need to find where is the best quality of care provided. You know, it's the one area in which plagiarism does not matter. Go out there and copy the best and bring it back. That's really has always been the message. Yeah. Otherwise, we're going to remain running an NHS which is as old as that picture was painted.
Yeah.
You know, we need to move from that into a digital system. And if you talk about the three major shifts, which has been the aspiration of the Secretary of State, which is hospital to community, treatment to prevention, digital, analog to digital. And if we get those three things right, I think we probably have a better chance of a whole system transformation and doing it with partnerships globally. India will be one of them, but there are many other systems that we can learn from.
Ladies and gentlemen, we're out of time, but I think we have a great panel. Thank you. Thank you. Good.